Yeah.
Good evening and Om Namo Narayanaya. On behalf of the Ramakrishna Clinic of South Africa, Durban, we would like to welcome you to this evening's online presentation by Dr. Usha Vasthare. The topic for today is the mind management in chronic illness. We are very blessed and privileged to have Dr. Vasthare with us. Dr. Vasthare is a popular speaker at our ashram events, being an ardent devotee of Sri Ramakrishna, Mother and Swamiji. Dr. Vasthare is a neuroscientist and social worker by profession and is concerned with mindful talks. Today, she will present her talk to us. I would just like to encourage everybody that this is an interactive talk and you are welcome to ask questions at any point in this presentation. You don't have to wait for the questions to be asked at the end. You can post your questions on the Zoom or YouTube platforms, or even raise your hand and you can speak in person. Just to remind you, in terms of the POPI Act, we're just trying to maintain confidentiality. So if you need to change your name or send it discreetly, you're most welcome to do also. So without any further ado, we welcome our dear Dr. Vasthare to please give us the talk for this evening. Thank you.
Okay. Thank you, Nikki.
You're welcome.
Let me start sharing my screen. All right. The title, it's all about mind management in chronic illnesses. We all are aware how there is a very close connection between body and mind, especially during chronic illnesses. Whatever happens physically affects our mind so much. Many a times, the state of the mind actually is the cause for healing in chronic illnesses. If our state of mind is not as hopeful, if it is not as positive as it should be, it has a strong bearing on healing of any chronic illness. The name itself suggests chronic illness. There is a big difference between illness and a disease, If we very simply put, a common definition or common difference between disease and illness, we can understand this way. A disease is one where we can get cured by it, whereas any chronic illness, it is not about just curing, but managing throughout our lives. Many of the illnesses are like this, or many of the diseases which are like this are called chronic illnesses, if you may. So in that respect, managing our mind, in spite of having either anxiety towards our future or anxiety towards what is happening at the present moment, will have a strong bearing on our healing. So chronic illnesses may not be cured, but it can be healed and it should be healed. So with this in mind, if I can simplify this title, I would just say, we are going to look at some of the principles of rehabilitation, because chronic illnesses have to be rehabilitated. At what levels? We're going to look at it. What is rehabilitation? What are the principles of rehabilitation? And to bring in the neuroscience perspective to this rehabilitation process. Most of the times, either we are going through some disease or we are taking care of somebody who has a disease or illness. If we are neither a patient or a caregiver, we are lucky and it's for a certain period of time. But sometime or other in our lives, we are either patient or a caregiver, and many at times, both at the same time. We are caring for our own health, and we are also caring for our loved ones' health. So keep this in the back of your mind as we go through the presentation. As Nikki mentioned, please feel free to ask questions and make it as interactive as possible, because chronic illness is such a vast term and it encompasses many of these diseases, be it may cardiovascular diseases, or it could be cerebrovascular diseases, it could be cancer, anything to do with allergies, or it could be to do with managing and maintaining our blood sugar levels, diabetes, or as we see these days, some chronic renal conditions. This is just to mention a few of the chronic illnesses. So keeping this in mind, we're just going to take a stroke as an example to explain for a couple of reasons. One is that my basic science research experience was on stroke and spinal cord injury, and clinical research experience was on Parkinson's disease. That is one of the reasons. And also the other reason is next month is National Stroke Awareness Month of this country, of South Africa. So keeping both this in mind, Dr. Shivani Singh and I decided that we will take stroke as an example to make you understand some of the common principles of rehabilitation of any chronic illness for that matter. As the saying goes, when you change the way you look at things, the things you look at will change. Hopefully, after today, you will look at rehabilitation from a different perspective. That is our idea, our wish, and our hope to all of you. So, what is rehabilitation? In general, rehabilitation is a lifelong process. Whether we know it or not, whether we have thought about it this way or not, it is a lifelong process. As soon as we hear this, more anxiety sets in. But the reason I want to start this as a lifelong process is not to create anxiety, but to create and to bring in a lot of hope, really a lot of hope to know and to understand any kind of rehabilitation is a lifelong process. And rehabilitation is also one's own responsibility. A doctor or a therapist might give you broad guidelines, general ideas, might say, no, you need to be doing these things. as often as possible and never stop. And as soon as we feel a little bit better, many of these rehabilitation practices we stop. That is the way, the nature of mind, As we feel better, we kind of take things for granted and we stop. But again, to make you understand, any practice that you're going through, any rehabilitation practice for any kind of chronic illness, make sure you understand it's a lifelong process, which means it is full of hope. Also means it is also our own responsibility to be continuing with these practices. So if you're seeing a therapy right now, and whatever your insurance covers it for, it can cover only for a certain period of time. But after that, talk to the doctor or talk to your therapist and ask the person, can you give some broad guidelines or give us certain information about the exercises or whatever therapy sessions you're going through in such a way that I can continue at home. I can assure you some of the things that you're doing it at the therapist, you will never be able to do at home. But the therapist will help you figure out ways and means that you can also do it at home based on what you have. So, two important things, lifelong process, and it's one's own responsibility. And rehabilitation also includes caregivers, if there are any. Many a times we are living by ourselves, we don't have anybody to take care of us. So you don't need to worry about it. But if there are family members at home, if they're also in the process of rehabilitation, we also need to include caregivers in this, because many a times there can be a burnout of caregivers. This is also for therapists. This is not just for patients I'm talking about. Also, the doctors and therapists need to keep this in the back of your mind, how you can include caregivers in the rehabilitation process. We will discuss about this as we go along. Many a times, even though the therapist and doctor is trying to give you emotional support in their own way, as patients, we don't realize this importance of the support that the medical professionals are giving. And also, just a note to the therapist, maybe we need to make both the caregivers and the patients understand how big giving that emotional support is, how big a role giving emotional support is. And maybe take 10 minutes of each session to be able to provide emotional support to both the patient and the caregivers. And as you see, I have put emotional support plus. Purposely, I have not mentioned what that purpose is. Plus is, this is where I want you all to put on your thinking caps and then see what is that plus. Rather than asking me what that plus is, I want you to think about and give me your suggestions, what you're looking for from medical professionals, other than whatever therapy that you're going through, other than emotional support. Is there anything that you're looking for? And at the end, I will give you my suggestion too. I'll value add to whatever you're going to be asking for. Think about this, providing emotional support plus anything else that you're looking for.
Dr. Usha,
Yeah,
sorry to
right.
interrupt. I think what you said is very valuable, and I wanted for you to just discuss it further. Many
Sure.
patients going through the problem don't realize that lifelong process, and a part of fault is medical people that don't prepare people for this long journey. Often you admitted in hospital with a devastating problem, and the priority is how quickly can I get better. So people don't realize how long rehab will take, what your residual problems are, and that how you are now a changed person. And same way, what would be the dynamic into the family where their roles are now changing. So if you could just please discuss a little bit about that for families.
Certainly. Can we go a little bit further? And then I would like uh, let me give some of the principles, and then I will
Okay,
take up that question, Nikki. But
no
as you
problem.
rightly said, yeah, I will touch upon it because I want to
Sure.
go deeper at many different levels. Let us touch upon it. You're
Okay.
absolutely right. As simple as a fracture, as simple as some kind of an orthopedic surgery,
Yes.
we take this for granted. And we don't realize, depending on what age we have had that surgery, as simple as orthopedic surgery connected with fracture, let us say. For many people, that would be it. Whatever they're going through, the pain will be relieved after several weeks or several months. But for many people, the pain either lingers or it keeps coming back for many different reasons. And if anybody is listening, if they have had that experience, I would like them to ask certain questions personally, what they're going through with this. Because as we get older, especially the aches and pains, just is so directly dependent on sometimes just the weather. It could be muscle aches and pains. It could be aches and pains of not even the muscles, not even the bones. It could be just the tendonitis, or just the inflammation of the connective tissue. All of this causes so much pain. Earlier, we would just club all of this together as just pain. Or if it is something related to the skeletal structure itself, the bone, we would just say, oh, it's arthritic pain, joint pain. But even in arthritic pain, we are understanding it is not just the joint pain of the bones. It is about the tendons. It is about the ligaments. It's about the muscles that are holding those bones together. So if we tease out even that arthritic pain, not just as the pain of the joints or the bones, it can be tendonitis, it could be the pain of the ligaments or of the muscles or all of this. For most of such pains, it is the movement that really helps. Of course, movement also hurts, except for certain conditions. Movement is the one that will relieve most of such arthritic pains. As medical professionals, when we are taking care of many other things, it's hard for us to be able to educate the people about such pains, especially after we age. After a certain age, we just say it's arthritic pain and then we just accept. Rather than that, tease it out. And then, as simple as stretching, sometimes just getting out of the bed is enough for the pain to be relieved. I can assure you that. Or just taking hot showers is enough rather than just going for that painkiller. These are the things that this is also what I call rehabilitation. If we look at it from that perspective, it empowers us, because we are the ones who will know our bodies better. It's us, not the doctor, not the therapist. They will help us to know our bodies better and our minds, but we should be our own healers. So we need to educate ourselves about all of these things, and including what we ate, what time we ate, which is causing. I've just taken pain as a simple example, Each one is different. For different people, different types of food will affect. So we need to be so educative about all these aspects. Sometimes fasting helps to relieve the pain, believe it or not. These are the ones we can try all these different things on ourselves. And this kind of quote unquote research on ourselves is what empowers us. And this is the kind of support I'm talking about, not just emotional support. How food itself can act as medicine. We call that as nutraceuticals. And then we will see, I'm going to come up with a newer term, behaviorseuticals. That means our own behavior, our own lifestyle, when we change, that itself acts as medicine. So it's not about cutting down on sugar because we have diabetes. We know for certain it is not about diabetes. Just cutting down sugar, cutting down on processed foods will improve our health conditions so much. And there is a lot of research that has been done. And not only cutting down on sugar and processed food and canned foods for that matter, because canned foods are being used especially in Western countries and also other countries more so than India, So canned foods, processed foods, and white sugar. If we can cut down on these canned foods, which have a lot of salt content, these days we do get canned foods which are devoid of salt. You can keep that in the back of your mind. But if it is possible to cut down all processed foods, because canned foods come under processed foods. Processed foods and white sugar, if we can cut down, we will see how our health improves. So these are the things, just little bit of education, either from the medical professionals or from the paramedical professionals, will go a long way. Even though many of the people are quite forward these days to be able to do a lot of research on the internet. But when it comes from the medical professionals, it really helps a lot for the people to believe in this. And again, coming back to the emotional support, how can we keep our mind as positive as possible? And if there are more people than one person at home, if one is negative or for whatever reason, there is some negativity in that person at that moment, you make it a point, the other person has to be positive at that time. Just like, I tell people when they come for couple counseling, as long as both of you don't get angry at the same time, you're okay. Not only both of you should not get angry at the same time. The other person who is not angry should be able to bear the brunt and absorb all those negative emotions like anger. But this, you cannot practice this when the person is angry or when the person is low in their mood because of their health condition, what they're going through. This is the understanding one has to have much earlier. I think with this, I'll move forward. If you have anything more specific, Nick, we can I can take it forward. Otherwise, based on this, if you have any follow-up questions, please go ahead.
No, Ma, there's no questions at the moment. Thank you.
I didn't hear you, Nikki. I'm sorry. Yeah.
Yes, sorry, there's no questions posted at the moment.
Okay.
You can carry on. Thank you.
All right. It's my internet connection is not stable. Now it's fine. Okay. Now, I'm just going to take, as I said, stroke as an example and just give some statistics to see how any chronic illness has an effect on our, at the national level itself, on its national economy is affected because of chronic illnesses. And then let's just see. I'm just going to take a few examples like US, South Africa, and India. We'll just go through it quickly. You can see every 40 seconds, someone in US has stroke. Every 3 minutes, someone will die of stroke in US. And globally, 1 in 4 adults over the age of 25 will have stroke in their lifetime. The statistics is huge globally, not just in US. And statistics of stroke in South Africa. Of course, stroke is one of the leading causes of death and disability. Every hour, on an average, 10 adults will suffer from stroke. And every day, 225 people die of stroke or heart disease in South Africa. Nikki, if you ask me, this statistics is really, really low, especially countries like South Africa and India, which is what I'm going to be showing next. We do not have that rigorous way of collecting data to have statistical data as in US, as in Western countries, you know. So whatever I could get on the internet, and I'm just sharing this with you, but we can take it for granted. Statistics both in India and South Africa, I feel it is on a lower side as had been represented. In India, around 4,000 stroke cases happen daily, and only 2 to 3% of those 4,000 stroke cases are being treated. Can you imagine? Only 2 to 3% are treated, those who have stroke. So separate, why does this happen? That is much later, but we'll just stick to some of these and then move forward. And close to 20% of the first-time stroke patients in India, they were under 40 years. This is an alarming statistics because we know for sure that Indians and Africans, this I'm also talking from the data in US, African Americans, I would say Africans anywhere, they're more prone to stroke than the whites is what the statistics data show. And India currently accounts for 60% of stroke patients worldwide. And one of the reasons is, I think, in India still holds number one in the number of people who have diabetes in the world. Anyway, that's just some statistics. But let's see how we can tackle the stroke, how we can be stroke smart, as they say in National Stroke Association of USA. There are 4 R's. First is reduce the risk of stroke, and the risk factors for stroke and heart, they are one and the same, no difference between the two. I'm not going to go into each and every one of these, but just to give you an idea, but we can go into any of these if need be. Recognize that you have stroke symptoms and respond at the very first sign of stroke so that you act immediately. That's why stroke has been renamed as brain attack, because we know people know the symptoms of heart attack and they run to the hospital immediately. However, if it is stroke, they just wait it out for several days, and by the time they go see the doctor or go to the hospital, it might be too late for a particular treatment which needs to be given in the first few hours after having stroke. So with the first sign of stroke, just go to the nearest hospital. And rehabilitation, as I said, is a lifelong process and it's one's own responsibility. 4 hours of being stroke smart. Now we're going to focus on rehabilitation, which is a lifelong process and it's one's own responsibility. Here we go about principles of rehabilitation. What is it? Extremely important. The brain can change. And the brain can change at any age. Yes, it might be a little slower as we get older, but the brain can change and the brain can change at any age. All of a sudden, why am I talking about the brain? Whether it is physical rehabilitation, like we see with stroke or other neurological disorders, or emotional rehabilitation, any kind of changes that we are trying to see, which means either at the level of the body or at the level of mind, both of them have to result in changes in the structure and function of the brain. This process is called neuroplasticity. Until and unless the structure and function of the brain changes, there won't be long-lasting changes, either in our behavior or the way we think, we feel. So the first principle of rehabilitation is to know that the brain can change and the brain can change at any age. And the brain changes at a structural level and the brain changes at functional level too. I'll just briefly go over with what do I mean by that. And the functional changes will lead to structural changes. Eventually, we don't need to do anything. As long as there are functional changes in the brain, it will lead to structural changes. And if there are structural changes, that will also lead to functional changes. We will see what do I mean by that. As I said, just mentioned, this whole process is called neuroplasticity. So coming back to the principles of rehabilitation, going a little bit deeper into this, whether we have thought about it this way or not, our brains are designed and we are evolved to move our bodies around and also to think. We have not thought about human evolution in this way, Humans are made to move around right from the beginning and to be able to think. And our behavior, our actions, our experiences can change not only our neurochemistry of the brain, but also our neuroanatomy. Another way of saying that when we change our habits, when we make lifestyle changes, that will result in changes in the function and structure of the brain itself. So change your actions, change your behavior, change your habits, change your experiences to change the neurochemistry in healthy ways. This is again a plug-in for some of you to understand. This is what the principle that we are using over the weekend. We are conducting a workshop both Saturday and Sunday here at Avoca Ashram in Glen Anil, Durban, which is again a hybrid model. People can come and attend the workshop, or it can also be online, and it will be online, to treat depression using this principle. How we can change the neurochemistry of the brain itself by changing many of the things that you'll have to attend that workshop to know this at a deeper level. So these principles of rehabilitation is so powerful. The same principles of rehabilitation can also be the principles of treatment for some of the mental health conditions, be it may depression, be it may anxiety, be it may obsessive compulsive disorders, be it may for bipolar, for many of the mental health conditions. These principles of rehabilitation will also be the principles for treatment itself. And again, this whole process is called neuroplasticity. And recently, Dr. Lambert has come up with a term called behaviorseuticals. That means why do doctors say make lifestyle changes? If you need to reduce your cholesterol, if you need to reduce your weight, if you need to reduce your blood sugar levels, if you need to reduce your blood pressure levels, make lifestyle changes, that they say. That is nothing but they have coined the term behaviorseutic, just like pharmaceutical, wherein we use medicine as a way to treat, or pills used as medicine. Our behavior, our lifestyle can be used as medicine. And all this knowledge can be used as medicine. That is what we are going to go much deeper in that workshop that is being conducted here this weekend. And this is what we also addressed last week with regards to anxiety. Okay, then we've been saying neuroplasticity, right? What is neuroplasticity? Let us understand it in a very simple manner. Neuroplasticity is the ability of the brain to change and adapt itself due to our life experience. Another way of saying, brain, the ability of the brain to change, to reorganize, and to grow neural networks at any age. Sometimes to grow neural networks, sometimes to prune off to cut off many neural networks. They both can happen under different circumstances, and that is neuroplasticity. For example, people with addiction or with certain type of repetitive thinking, we need to prune off certain of the neural networks. And that is also because of neuroplasticity. That also is neuroplasticity. So this neuroplasticity can involve functional changes due to brain damage or structural changes due to learning. What do I mean by that? We'll go into this just a tad more detail. So neuroplasticity, it has mainly, you can classify into two types: functional plasticity of the brain and structural plasticity of the brain. Functional plasticity is the brain's ability to move functions from a damaged area of the brain to other undamaged areas. What do I mean by that? We have seen, especially kids or even adults, when they become blind, kids, they are born blind. Some other sense organs works even better than others. Their hearing capability might be better if their visual capability is affected. So that is what I mean by an example of functional neuroplasticity. And also sometimes a different region of the brain will take over some of the functions. That also is functional neuroplasticity. And structural neuroplasticity is actually the ability of the brain to change its physical structure as a result of learning. When we learn new things, or unlearning for that matter, learning new things that are necessary for us, or unlearning when it comes to addiction, when it comes to repetitive thinking, when it comes to OCD, to unlearn certain of the things, that is structural plasticity. So that's what has been shown again here, two types of brain plasticity. When a baby learns, when a kid learns, when we learn something new, those experiences or the memories can change the physical structure of the brain itself. That is what is called structural plasticity. Functional plasticity is, as I just mentioned earlier, let us say, for example, because of stroke, one area is affected. Some other area can take over the function of the brain. I will give an example or a metaphor to understand this functional plasticity in a better way. If you're if you're driving and there is traffic jam on that road, and you take detour, and then you want to reach wherever you want to go, right? When you take a detour and then go different, that is nothing but, again, if one area of the brain is blocked, let us say because of clot formation, as it is in stroke, the blood flow can gets diverted into other regions. And because of diversion of the blood flow, or even the surrounding neurons in that area will start functioning much better. And that is, again, functional neuroplasticity. If one area is not working, the adjacent areas will take over the function of that area. So the function of the area that is affected. And that's a simple example of functional neuroplasticity. So again, neuroplasticity refers to the lifelong capacity of the brain to change and rewire itself in response to the stimulation of learning and experience. A different way of saying again, as I said, rehabilitation is a lifelong process. Neuroplasticity also can be a lifelong process because the brain has the capacity until our last breath to be able to change and rewire itself because we are learning new things, we are unlearning old things, and we are having new experiences. Because of that, neuroplasticity is a constant process, as a matter of fact. So the more we engage and the more we practice and the more we repeat each movement over and over again, now we're just talking about an example of physical rehab. And there are more and more new neural connections and new neural networks can happen, new pathways in our brain happens, and then that gets stronger and stronger. I will briefly mention about the problems of neuroplasticity, and then we can take up questions if people have, Nikki. The way I'm saying it looks like, oh, everything about neuroplasticity is golden, everything works really well. Not really. We need to understand this next aspect of problems with neuroplasticity, which is, the brain changes are often seen as improvement, but this is not always the case. For example, the brain structure and function can be negatively influenced. If somebody has a negativity mindset and it becomes their personality, the first thing that comes out of somebody's mouth, oh, I cannot do this, I cannot do that, or that can never be done. For whatever reason, ultimately it boils down to fear, anxiety, or any of those reasons. If that has become a habit, that is also because of neuroplasticity. Until and unless we recognize that, and our self-awareness is heightened so that we are able to recognize and be able to change, there is no other way but be able to be aware and change. That again is an example of brain plasticity or neuroplasticity in a negative manner. We have seen this many a times, either within the family or at work. Somebody or other will be there. The first thing that comes out of their mind, of their mouth is, oh, that cannot be done. Or they will come up with something, how difficult it is that cannot be done. And I'm just giving a very simple answer, not just something that cannot be done. You tell them something and then they say how they cannot do certain of the things. How, as simple as when we suggest lifestyle changes, right away they will say that I cannot do because of this, this, and this. A very simple example, because we do this all the time. And there is no medicine to change this. We ourselves have to understand and be aware. And this knowledge is what is going to help us. And it is not about pinpointing mistakes of in others or in ourselves. Don't think of it as a mistake or error that is happening. It has just become a habit without our knowledge. Now we can be aware of that and be able to change that habit. Again, brain plasticity can be a problematic thing during substance abuse, any type of addictions. It could be with disease, like in depression, going into that vicious circle of negative thought patterns and being in that negative loop. It could be the anxiety being in that loop of negativity, or it could be somebody having gone through trauma without that knowledge. It happens at a non-conscious level. And there are ways that we can be aware of that, bring whatever is in the subconscious mind to bring it up to the level of the conscious mind level, and to be able to change that. If we can even just understand this is also because of neuroplasticity, but in a negative way. If we are capable of having such issues of brain plasticity in a negative way, we're also capable of changing that into the most positive way. That is the hopeful statement I want to give in this juncture. I think with this, maybe can we take up some questions, Nikki, before we go further?
Oma, thank you for that. We've got a question from Shivani, Dr. Shivani Singh. You can please unmute and speak. Dr. Shivani?
Yes. I think one of the problems that a lot of the chronic illnesses encompass is the fact that there's an element of physical pain that can be associated with it. And how would, or what would be the mental techniques one could use to overcome pain and to reduce the aspect of pain? I think it's interesting that you also mentioned the substance abuse as part of the negative aspects of the neuroplasticity when dependence to pain medication becomes prominent. And also now with the advent of cannabis, which is quite popular as a pain modulator in the common practice in South Africa. It's becoming more popular now, although it's not yet medicinally prescribed. So I think it just to factor in somebody who is undergoing pain on a physical level and how to overcome that pain on a mental aspect in terms of neuroplasticity, and allowing that pain to be overcome or reduced in a way. Thank you.
Yeah, a great question, Shivani. I was not going to go into that, but it's an extremely important aspect, because pain is one of the symptoms in any chronic illness, not even chronic illness, aging, normal aging, many a times for many people is associated with pain. And we now know, and beyond doubt, and I'm talking about evidence-based research, that either we can increase the threshold of the pain or decrease the medication for pain if we involve with certain of the mindfulness techniques. And that is a separate topic in itself, but it's not that we can go and meditate while we are in pain. Trust me, it can never happen. Only if we are using these mindfulness breathing techniques, some people call that meditation, whatever you want to call meditation, mindfulness techniques. I'm just broadly saying mindfulness techniques. There are many of them, of course, not just one technique. If we are using that on a regular basis, this is when it will help us when we get into that cycle of pain. It is, of course, if you have been practicing this, you can also use it to relieve pain in an acute manner. But for somebody who is a novice, it's almost impossible to use the meditation technique acutely to reduce the pain. extremely important differentiation that we need to understand. So we know mindfulness techniques at various different, many different techniques, not just one breathing technique. It could be visualization, it could be PMR, progressive muscle relaxation techniques, and can also kind of customize. We have tried to customize for people with particular pain. We can go into that detail, you know, or go deeper to be able to use these mindfulness techniques to either relieve pain or to increase the threshold of pain and to decrease the pain medications.
Thank you, Ma. I've got one more question, please. How can a patient keep going or keep progressing over time? Often with chronic conditions like a stroke, the initial phase is where you see big improvements, but over time, the improvements become less and less, and this becomes very demotivating for patients. So how would a person going through this type of problem keep themselves motivated in terms of neuroplasticity or other methods, please?
Oh.
Thank you.
Yeah, a great question again, Nikki. I'm going to go into how this helps in the next couple of slides. I will answer that question at that time.
Okay.
When does this help? How should we be doing those exercises to make it work? That is the key factor. I'm going to go into that in the next couple of slides. I will do that.
Okay.
Because then it makes more sense when you see the numbers, what I'm going to be putting through.
Okay.
Again, very good question. This is where it is so hard to, for a therapist, for a medical professional, especially for chronic illnesses, it becomes, our role will become to keep their spirits high, to keep them motivated, to keep them inspired more than anything else. And there itself, there again, that burnout of medical professionals too, caregivers, even medical professionals are caregivers. It's not just the family members, you know. So even they need that emotional support, including doctors, therapists, medicals, and paramedical professionals. Because when we say caregivers, the first thing that goes to our mind is the family members. Even more than the family members, because the family member is involved with one patient. The medical professionals are involved with so many. So there is definitely that burnout. And we need to be motivated. And that is why what we call it a CME course and what you call here a CPD course is there. It is needed. The goal of that is for that reason. But many a times we don't directly address that issue. So this has to be a constant process. In fact, while I spoke at Dr. Shivani's hospital in Kosi Albert Luthuli Hospital, I was mentioning to the physicians there that just listening to that 2-hour CPD course that we had last week was not going to be enough, but they need on a regular basis, whether it is a CPD course or not, for medical professionals. They all, especially in this day and age, especially after post-COVID, there is a strong need for emotional support, even for the medical professionals. Any other question before I go further? Can I go ahead?
That's fine. Thank you. You can go ahead.
Sure. We'll just quickly go through what are the types of rehabilitation and then go into the neuroplasticity aspect. We're aware of this physical therapy that improves our walking and range of movement, occupational therapy to help us take care of oneself, to do the activities of daily living. That occupational therapy certainly helps. And it could be for speech language therapy. This is not limited to stroke, many other disorders too, including Parkinson's and few other neurological disorders. Speech language therapy to improve communication skills, to improve the swallowing that gets affected in many of the neurological disorders, and to improve cognition. Recreational therapy, like cooking, gardening, which helps for entertainment. And again, I have put as plus. I would like here, we have already mentioned some nutraceuticals and behavioraceuticals. Other than that, both by, I know there are many medical professionals here. If it is being live streamed, if they are putting certain answers on the YouTube, I would request Sanjeev to be able to give us those answers, or anybody else who is following that. What do I mean by plus? What other types of rehabilitation that we don't really talk about? Okay, let me just give some ideas, just like what we talked about, Nikki, to keep their motivational levels at a higher level. That let us call that as therapy, so that people will get serious about it, you know. Yes, Nikki, you're gonna say something?
No, that's fine. Nothing.
Okay. So to keep our patients motivated, to be inspired, and even medical professionals, we need to learn how to keep them motivated too. And even for them, even for the patients, they can look for different ways how to keep up their inspiration and motivation high. And of course, one of the time-tested ways is to attend support group meetings, either a general one or a specific one for that particular disease, to be able to help them to keep motivated. That is one. And then, have we thought about, for people either who are religious, for people who are spiritual, to have that as a therapy? These are the things that we really need to look into various different ways. Many a time, some of these need not be so, how do I say, dry and intense. We can make it as interesting so that they can be learning newer things to be able to go through. All of this can come under support group meetings, which is what usually does, but I'm trying to give ideas. We can educate patients, many of the things, especially for to give emotional support through storytelling mechanism, you know, or if they are, if they belong to a particular religious religious group, then figuring out ways and means how religion can help to keep their motivation high. If they're not religious, but they are spiritual, then maybe something else. If they are religious and spiritual, different ways. Until and unless we really go dig deep within ourselves as medical professionals, to be thinking about these things in a structured, organized way. Yes, we're all, many of us are doing this. in our own limited way, in our own capacity, at an individual capacity. Good physicians, good professionals are doing this. But can we think about this in a structured, organized way so that it becomes even more acceptable for the patients? That is what I mean by plus. Anybody wants to add anything to this? This is the time before we go further. Nikki.
Thank you. There's no other questions at this point in time, but I have to comment on occupational therapy. That's why I love being in my profession, because this is where we look at a person as being well-rounded. Ma spoke about the activities of daily living. So this is what we look at, is how a person's functioning in terms of their home environment, with their families, with leisure activities. And often as medical people, we forget to do that for ourselves as the caregivers, because we need that balance in entity. And what I advocate for my patients is that we have holidays, even from therapy.
Absolutely. Yes. I lost you, Nikki. I'm not able to hear you.
I think there's a problem with the link while she's getting back on. Ushma, in terms of positive visualization, to what extent is that applicable to patients? And when I talk about that, I think about children with chronic pain, chronic illnesses, and what aspects would be able to assist them in terms of rehabilitation from a non-physical level, where we applying more mental therapy in terms of that.
Yeah, again, it has to be intense in the sense, not at one time for a long time that nobody will be able to. If it has to become therapy, that repetition is what is needed and important, Shivani, whether it is a physical level or at a mental level. A repetition, like on a regular basis. And if it has to become treatment, repetition for a shorter period of time, but more number of times, the frequency has to increase. Otherwise, it is looked at as a feel-good technique, for it to become a treatment. That repetition is what is so important. And as Nikki was saying, yes, Nikki, what we are trying to get at is not just look at the symptoms, not just look at one organ, but to look at the person as a whole. We use that word holistic approach, integrated approach so easily that as medical professionals, we will understand, we know what we mean by that. But from a patient's perspective, until and unless it is teased out like this and then make them understand, because a lot of these, they will be able to do this themselves. That is why I keep saying it is one's own responsibility. There is only so much we can do as medical professionals when they come to the hospital, when they come for the therapy. You can only do so much. But our role also has to educate them. Whatever exercises you're doing here, you have to repeat that many more times at home. That however much we can stress and make them, convince them, that is the way to go. That is what I'm, yes, go ahead. Shivani.
So, Usha, I just wanted to also ask you that, some of the criticisms of positive visualization is that it's a false belief in terms of something that's not there. How does that impact or differentiate from techniques for neuroplasticity in terms of rewiring the mind?
Great question again. You know, Shivani, the brain cannot tell the difference between what is real and what is imagined. The brain has imagined so much of negative things that will not happen about the future, may not happen. But in the present moment, we imagine that so much and we start believing it. If that has caused all this negative neuroplasticity effects, it is the same thing, believing in something positive, something noble, something healing has to cause positive effects. Logic, simple logic is enough. But now we have neuroscience to back that up. Because the brain cannot tell the difference between what is real and what is imagined, but we need to really feel it, and it has to be intense. The intensity is important because we know the neural networks for negativity is so strong. But for us to feel positive, it is like lukewarm effect. Even this we understand somewhere, hopefully in the next several talks, we will get to this, that why there is a neurological evidence for this. The neural networks in the brain, where we start off at a conscious level, the connections are so weak when compared to the deeper regions of the brain. Whereas the neural connections at the conscious level, at the higher center of the brain, at the cortical level, is each neuron can connect up to like either 5,000, 10,000, or at the most 40,000 neurons. Whereas at the level of amygdala and other deeper regions of the brain, including the reptilian part of the brain and whatnot, each neuron can connect up to 100,000 other neurons. Look at that power. So if we understand this neurological significance, why the negativity for most people, highly educated, highly successful people, even they can get into this by understanding this only. And just understanding is not going to be enough. Knowledge is not going to be enough. This knowledge has to be put into practice, and it's extremely tough to put it into practice by themselves. This is where the support group meetings are so helpful, or for normal people wherein we're not into any kind of illnesses, but only at the mental level. If we are making a shift, being in the right company is so important. We need to come out of the company that is causing us more and more negativity. Even such people will not understand gossip mongers, and they're all false positive. Even false positive is again is nothing but negative. To consciously come out of such people who are influencing that negativity habit, we need to be able to recognize it as nothing against the people. It's nothing against the people, but we should be aware of both our own thought patterns and be aware, not judge them, evaluate who is negative, who is saying certain positive things about anything for that matter. We need to be able to evaluate, not judge them, and associate with such people. Then and only then will we be able to keep up with our practices. Especially the mental practices that you talked about, Shivani. Okay, we will move forward if there are no other questions. Nikki?
Yes, you can go ahead. Thank you.
Okay. So again, coming back to the principles of neuroplasticity, whatever we do, any practice, rehabilitation practice, it has to be very meaningful for us. And we need to understand why we are doing this. Like, for example, if it is at a physical level, why we're doing this exercise, just a little bit of science behind it, if we can explain to the people, that gives them some motivation. And why am I doing this activity? If it is mental, it is even tougher. That why has to be important. Why am I doing this? And that why has to be strong. Until and unless I know why I would like to come out of a certain situation, it is not. That is where the motivation level keeps dropping if they're not able to maintain whatever level of rehabilitation process that they have come up with. And whatever it is, it has to be intense. Even the exercises we teach them, it has to be intense. It has to be high effort. There has to be sweating, huffing, puffing, including some pain will be involved. And then, of course, we need to educate them how to handle that kind of pain also. If it is not intense, it will not work. That means it is intense and challenging, high repetitions. And when they come to the hospital, we can try and make them just 3 reps of 10, the usual stuff. That is not going to be enough. But of course, at the hospital, we cannot do anything more. We need to educate them for it to become or to change at the neuronal level. It has to be 300 repetitions in an hour, not just 10 repetitions 3 times, in a day, but 300 repetitions in an hour. Can you believe this? Then, and only then can they, especially in the beginning, it is so important for such intense, challenging repetitions, exercises, especially physical exercises, and also mentally. Of course, this does not, what the example I have given does not represent for the mental, but for mental, it is the company, the right company is very, very important. And these exercises, at least I'm talking for stroke, it has to be specific for that person. And which also means the patients need to be in constant conversation with the therapist. Just like no 2 strokes are the same. As the person is undergoing the therapy, they also have to, their needs will be different. And the communication with the therapist and the doctor is extremely important here. And there could be for the same type of exercise. And even as therapists, sometimes we know you can be so creative, Nikki. And then the same way, we need to be very creative because different people accept different things in different ways. So this is what I meant by, Nikki, I will answer your question later. This intense, challenging repetitions. We need to put this in the patient's mind. We need to have this kind of information in the hospital, in the therapist's office, so that it gets honed in, or you print it out in a card and then give it to the patient every time. This is what is important. And I can understand they will be tired and there will be pain, there will be resistance, they will not be ready to do. But first we need to convince them intellectually. Just like even for mental rehab, not even rehab, for us to be able to make certain lifestyle changes, which is what we've been doing in this ashram, that repetition is important, or more than repetition, the convincing, the intellectual convincing. You can see that even here, it is taking us so much time to get to a certain level. Right? It's taking several years, and we still have a long way to go to be in the right company and to be able to make certain transformations. So certain belief systems have to change, and we need to forget about the past, all the things that I'm now talking about, personal changes and transformation, which is, we can call it rehab or whatever you want to call lifestyle changes at a mental level. Being in the right company, forgetting about all the mistakes we have committed, all the mistakes others have committed, but to completely believe in the future in a positive way and to be with the right company is what ultimately matters. This could be specific for stroke, so there is no need to. I will just close up and open up for more questions if there are any. So successful rehabilitation tips. It has to be lifelong practice, and recovery is one's own responsibility. And we need to include caregivers in the rehab process. Importance of emotional support. I cannot stress upon this. And especially places like this, when we try and do such programs as this ashram through the clinic as they're providing, we can see we are striving to give the best unconditional emotional support to everybody as much as possible, without judging, in an unconditional way. Ultimately, whether it is for physical rehab or mental rehab, for any kind of making changes in our lives, it has to be in an unconditional atmosphere. That is the power of support group meetings, because it's always unconditional when it comes to the support group meetings, at least the way it has been done in US, and that is how we are doing it in India. It's always on an unconditional basis. It's only people have to experience this to be able to understand what I'm saying. If there is anybody who has experienced this either in US or India, please feel free to share your views. So, the Stroke Awareness Month in South Africa is next month, as I said, September. So just a couple of points about stroke. First, we need to stop, which is the primary and secondary stroke, through risk factor management. Second is to act fast. That's an acronym that we need to remember, to increase recognition of and response to stroke symptoms. This FAST actually represents F standing for face. That is the first thing that anybody will be able to figure out, a change in the way one part of the face looks, a part of the either the right or the left side. It could be a slight droop or a significant droop. That is what F stands for. This is about how do we recognize stroke. as lay people, we cannot say, I'm going to diagnose stroke. Diagnosing stroke is left for the medical professionals. As lay people, we will be able to recognize even if somebody is having stroke. We have tried to do this in India for kids at the school level, and it has helped them. Many a times, even a young child of 10 years can be taught how to recognize stroke, and they have helped that. It has come in handy at home in many places, especially when there is an elderly person like a grandfather, parent. When at home, the kid is able to recognize that it is, and then has helped the parents too. So FAST stands for F for facial recognition. A, just to ask the person to raise the arm. When they're asked to raise both the arms, the side that is affected by stroke, they're not able to raise that arm to the same level as the other arm. That is again a sure sign. S stands for speech. Ask them what day it is, what is their name. Either they cannot think about what day it is, or when they speak, the speech might have been affected. Just these three are enough to be able for anybody to recognize if any person is having stroke. And T stands for time, whereas time is extremely important. Just like I mentioned before, the faster you take the person to the hospital, there are things that can be done within that golden hour to be able to treat particular type of stroke. We're not going to get into all those details now because that is not the idea. So just to recognize what is stroke, because this is next month is Stroke Awareness Month here in South Africa. And also to spread hope about recovery from stroke, that it is possible to recover from stroke, depending on the case. Each person is different, so they'll be able to recover to a different extent. So be a stroke hero and act fast for the Stroke Awareness Month that's coming up in September. Thank you.
Thank you very much,
Sure.
Dr. Vasthare. I think there's just one more question. That was from the YouTube channel. I just want to open that out, sorry. What is the opinion on the Rasanya diet Swami Vivekananda ji illuminated on?
Come again, Nikki? I didn't get it. I'm sorry.
That's what is the opinion of the Rasanya diet which Swami Vivekananda ji illuminated on?
Rasayan diet.
Rasayan.
What
Rasayan.
diet?
Rasayan.
So
Rasayan diet.
it's the Ayurvedic, sorry if I may just help, maybe
Yeah,
our
sure,
pronunciation is incorrect, but it's the diet, Ayurvedic diet relating to
Okay.
non-processed foods. I think, milk, ghee, all of that are part of that diet in terms of the natural products for that.
Absolutely. Ayurvedic diet or Ayurvedic treatment, it is usually for maintenance and for long term. If we know somebody is having certain infections, and then that's not the time to go for Ayurvedic treatment. Unless it is, if we know for certain it is viral, that's a different thing. To build up immunity in the long run, yes, Ayurveda. But if it is something so acute, that then allopathy is the best way to treat acute diseases, let's say. But for anything long-term, for well-being, for maintaining our health, there is no better way than either going for Ayurvedic treatment or following the principles of Ayurveda, which is mostly going for natural things. I used different scientific terms, nutraceuticals, behaviorceuticals. And if you go into Ayurveda, they will call it Nitya Karma. And then based on the months, seasons, you have to change the vegetables that you eat. They call that Rutu Karma, and different names are given, Ayurvedic or Sanskrit names. But we can also, not everybody will be exposed to such things. But if we are going to be interested, actually, it is our own Dr. Sharad Hansji, who is so well-versed. In fact, he was supposed to do that at Chatsworth a couple of weeks back. And if people are interested, we should have his talk on awareness of Ayurvedic treatments as such. But it has a great benefit, I can assure you that.
Thank you. Shivani, you've got your hand up. You can speak, please.
Thank you. Yeah, I have to agree, Ushama. I think, with the Ayurvedic, it's dependent on the personality and characteristics. So there's a lot of Western literature and scientific data coming up furiously now, speaking about immunomodulation, which is essentially what this diet proposes and the immunomodulating foods that reduce inflammation, which is now seen as the common pathway for all or most diseases in terms of what's happening. So the question I also had for you was, in terms of overcoming resistance, both on the part of the patient and the caregiver in terms of therapy. And I think it's quite a known situation that if a patient is depressed or in the processes of anger, engaging or finding the trigger that could help somebody out of that in order to enable the therapy becomes a bit more difficult. I think it becomes even more difficult when the caregivers are actual family members rather than people from the outside, as a sort of a receptacle for the anger and the depression and overcoming that. So how would one be able to find ways to overcome those initial phases to engage the therapy in those situations?
Yeah, it's a really tough question, Shivani. There is no straightforward, simple answer. But at least for the future, we can work on that, especially if it's a family member who is also a caregiver. And we need to build that rapport beforehand. We cannot build that rapport during the rehabilitation process or during crisis. We all feel that as a family, we're so close. But to be able to take such kind of suggestions, it takes a different type of rapport building strategies. I don't want to use the strategy, tools and techniques that are needed. Now, as I'm thinking about giving an answer, many of the things are coming to my mind, how it should be brought about, That's why these days, over a period of time, having worked in India, and I also see another faculty member of Yogakshema, Dr. Shobha Venkat, who is from Bangalore. She's on here. She's OBGYN specialist in Bangalore, also faculty of Yogakshema. What we have seen, and based on the 16 years of experience in India, what I'm trying to propose these days is to be familiar with at least 2 or 3 workshops for each and every family member. Not necessarily that they have to be attending the whole workshops, but the essence of the 3 workshop, which is forgiveness. Before that, importance of interpersonal relationships, forgiveness, and depression and anxiety both together. We are trying to bring this for individual families. There is so much resistance even for that. As a professional to be giving for families, we are still not ready as a society. As I said, the only thing for us is those who believe in this to be even more patient. We have to increase our forbearance. We have to be even more unconditional. We have to be even more understanding. We need to be even more kind and even more loving. And there is no other way but this, in my opinion.
So thank you for those suggestions, because I think the workshops and the groups that we have and the talks that we've had will also contribute to this. But I want people to have some sort of practical start in terms of how to manage things. And what you've just said now is quite helpful. But where in that process comes the tough love?
Yes, a good question again. I shouldn't be doing what Maharaj would do, but I have to say this, what Swamiji would say. Why should there be tough love based on our personalities, right? All of us have all the 3 gunas, 3 qualities, the tamasic, the rajasic, and the sattvic. It's not that there are certain types of people who are tamasic, others are rajasic. Yes, some are more dominant quality than the others. But the tough love comes in only when there is, at that particular time, wherein that tamasic becomes little bit more predominant at that moment. And it happens for all of us. And we have gone through, either our parents or our educators or our sadhus showing us tough love only for a particular reason, right? So the only reason for tough love is when that tendency of tamasic, or when I say tamasic, it's about resistance. I'm calling this as tamasic and nothing else. Resisting certain good things, when somebody is suggesting, I will label that as tamasic. And that is where, at times when we do not have time to work on that person, if it has to happen that moment, only then, in my opinion, this is my opinion, this is my suggestion, and I'm saying this through experience, tough love is needed. But even there, as much as possible, to be more loving and kind and understanding is the way to go. But even when we show tough love, this is where we need to practice this ourselves, and we need to be convinced beyond doubt. And after a few times of tough love, even the other person will understand where we are coming from. That to separate out the person from the actions. We're showing tough love for the actions, not for the person himself or herself. And the very next moment, even if we have shown tough love, the way we behave with that person will convince the other person to know that it was truly tough love, and then we did not mean anything. And with one incident of showing tough love, the other person will not understand. If we have that kind of relationship over several attempts, this is how we build that rapport with the family, with the patients, with the friends, with whichever relationship it is.
Thank you.
But those were great questions, Dr. Shivani Singh. You bring in certain deep things for me to think about and to propose many things. And you know, these questions will only lead to many more suggestions for you to work on.
Yeah, I think, you know, from our perspective and resources that we have, and the lack of resources that the majority of South Africans have in terms of rehabilitation and access to rehabilitation, just trying to implement the physical aspects of that therapy becomes very difficult. And, you know, it would be an ideal world where they have repeated access to all the therapists that need to be involved in this multidisciplinary way, but it's often not available. So it's almost, in a sense, trying to give a prescription when you see them for the first time, for the first interaction with the therapist, because that's what's going to be practiced at home. And that is the reality of the issues that we have and the resources that we face. I just wanted to ask, because I know that Dr. Parasnath, Charlene is on the meeting, and Charlene also has a lot of contact with patients that are oncology and malignancies, and just wanted to find out from her perspective was if there's any aspects of care that she can think of that we might benefit from hearing about. Charlene, sorry to put you on the spot. Charlene, are you there? Ori, sorry, I'm not getting any response from her. Okay, we'll have to address that.
Well, I just want to make a comment. I think, again, in my field, I'm very privileged in what I do as an occupational therapist, because as we speak, and I think this is why I'm a bit reflective and quiet, because we've come to experience this every day in our working lives. I always feel that I see more problems than I see normal things. And the difficulty comes that you have to wear the different caps. I've seen patients as they progress in different phases of the chronic illness. And like what Shivani Ma was saying also, that I think I always try to do something tangible. So we start off sort of physically in order to gain the trust and to build that rapport, to show, and there's physically hope in trying to develop and improve certain aspects. And I always tell my patients, even if it's a 5% or 1% improvement, that's all we're aiming for. And with limited resources does make that difficult. But again, I always aim for, at least if you can achieve some small change in the patient, it doesn't have to be reversing things, but if you have very tangible goals to work towards. And once the rapport is established, automatically it becomes a resource for the patients to confide to you. I, in my own practice, have learned that the caregivers are very important, and often we so focus on the patients, the physical needs and how they're doing, we forgot to check what's happening with the patients. And I learned that in my own personal experience as being a secondary caregiver, that you have to worry about what's happening in terms of the family support, because that's going to be the basis for helping the patient to develop. In terms of giving them breaks and being assertive enough to ask for help and scheduling time for themselves. So I also make that a big part of the therapy or the relationship with the patient and family. So I think thank you for the talk, because it obviously presented this entire holistic approach, and importantly also that the patient is the main role player. You can't force them to do things if they're not willing.
But I just want to add, you're absolutely right to everything what you said, Nikki. And I want to add one more thing to this. Maybe we can offer this, especially in this country when there is so much scarcity of any of these medical services. One thing we can do easily is to be able to give them emotional support, which does not need them to come to the office or anything. Through our Ramakrishna clinic here, we can give that emotional support, not just for the devotees, not just for your patients, Nikki, or Charlene's or Shivani's, but for the people at large. I think this is where this is the idea that I'm getting now as we are speaking. And this is where we need to move towards how we can bring some changes into the society where you have such meager services. Maybe we can put our thinking caps and then see how we can provide emotional support for the public at large. I think that's one thing we will be able to do it very effectively, I would say, especially in this day and age because of the technology.
Yes. Thank you. That's very encouraging. There's no more questions on any of the platforms at the moment. We have our chairperson of the clinic, Shivani Singh, Dr. Shivani Singh. So if she doesn't mind to please give us a few closing comments before we move the vote of thanks.
I thought I was talking too much, but I think it's such an important topic, and I think it's something that we haven't done before, but we've always felt a need to have it done because there's such a range of chronic illnesses that people are living with. That could really be changed by listening to you and employing the techniques of mindfulness and mind mapping in order to change the outcomes of where they are going, not only just from the patients that have been inflicted with illnesses, but also those that can prevent it, those who are aware of family histories, the genetics, and the sense of fear and anxiety about what comes next, and not just to prevent it on an organic level, but also on a more mindful and mental level, to be able to employ those techniques in order to actually have a better holistic life. So I want to thank you for lending your mind to this talk and for giving us the insight. And as you've mentioned, it's by no means at the end of a talk, it's only just beginning. And I would hope that people then would find the need to reach for more and be aware that there can be change and there can be a real difference made in terms of what we're seeing, that we're seeing the scientific research for that has been from the evidence past, and it's only now becoming scientifically feasible when it has been known for such a long time before through the practices of yoga and Ayurveda and all the other ancient modalities that have long before preceded. So I want to thank you for that, the talk. We look forward to the upcoming talks because I think they also lend itself to this topic. Our workshop on depression that's coming up this weekend on Saturday and Sunday, part 1 and part 2. And we really encourage and invite everybody, even if you think you don't need it, if you think that you know somebody who does need it, please let them know about it and have access to something that's freely available, so that we can alter the mind and how we look upon things. Ushama, any concluding words from you always?
The 4-letter word in rehabilitation is extremely important, which is hope. There is no way we can lose hope. With keeping that hope in mind, we just have to keep moving forward. Any kind of illness, and to be able to utilize our time now to keep our mind at a much higher level and in a positive manner, in a noble manner, to focus on our mind as much as we focus on this body. And that is where we will be able to move forward with a purposeful manner. Thank you.
Thank you very much. And I also want to thank Nikki for hosting as our therapist that we need. Thank you very much.
Hey, thank you once again, especially to all our attendees and all the different forums that we've had. We do appreciate you taking time to attend. And a reminder that we do have more talks by our guest speaker. So please take advantage of the different events that are being held. Just to remind you again, the depression workshop will be held in person and online for this coming weekends, the Saturday at 2 p.m. and Sunday at 9:30. We will be posting adverts. And on behalf of the Ramakrishna Clinic of South Africa, Durban, we would like to thank you again for your time, and especially to our very valuable speaker, Dr. Usha Vasthare. Thank you very much, Ma. And we appreciate all that you've done and advised us and motivated us to give us more to give and to come up with ideas on how to help serve our communities better. So thank you very much. And thank you to everybody again.